Hey everybody, welcome. I am just waiting for Dr. Vita to join us today. If you're here, give me a thumbs up, wave your hands, let me know what you're hoping to learn today. All right, let's see here if I can pull you up, Dr. Vita. People are still hopping on. Let's see here. There we go. Hey there, how are you?
Hi.
Awesome. Looks like people are hopping on.
Come on in, everyone. Come
on in. Well, when you're ready, I would love for you to introduce yourself and share with my followers who you are, what you do, who you help, and then we can kind of dig into the good stuff.
All right, so I'm Dr. Vita. I call myself a holistic menstrual coach, just because I help women regulate their periods so that they can get pregnant. So I'm really more on the fertility aspect of regulating their period. Of course, some women come that have irregular periods and that's it. But I'm mostly focusing my attention on women that are doing the work so that they can be able to ovulate and have their precious little baby.
Amazing. And tell me a little bit, just for myself, but also our followers, what kind of created this passion in you? Do you remember when that passion first kind of came to fruition?
It came when I wanted to conceive my son.
Okay.
I didn't get pregnant right away. I was devastated. Reached out to my friend, who's an obstetrician, gynecologist. And then I just wasn't getting like any help. I just felt like my wonderful field of medicine was failing. And I took it into my own hands. I went into the scientific literature. I looked at old protocols, published data. I found out so much information that wasn't out there. And so that's when I said, you know what? I am going to do things my own way. And so I did it within 2 seconds, pregnant.
Wow. That's amazing. And that is, we have a similar experience that led us both into our passion, which was we both come from the medical field and same situation, different. I wasn't trying to get pregnant at the time, but having a lot of hormone issues that medicine, as we experienced it in our backgrounds, could not solve for me. So I love that you were able to take that, the knowledge that you have, the ability to read studies and dive into that and really kind of sort through all of that stuff to get yourself to where you are today. That's amazing. What are some things that impact fertility that most people don't know about? I'm really curious to just kind of pick your brain on that.
Yeah, so I think people underestimate how much the external environment plays a role.
Huge.
For example, I was actually talking to somebody who works with EMFs.
Okay.
And so that is like a big, huge, I like spent all night long reading the literature about radiation, just like the impact that your phone has on, your growing baby when you're pregnant, on your fertility as a whole. People underestimate how much pollution plays a fact, how much our cosmetic products play a role in this entire fertility thing. So that's one thing that I'm a big advocate of, is just people really cleaning up and making sure that you're minimizing the environmental exposure that you have.
Right.
Now, of course, there's no way you can completely eliminate every single thing in the environment, but I think that people really, really are underestimating, especially in the past couple of years. We're in this craze of like these makeup YouTube ladies, and a lot of influencers are getting into makeup, and a lot of it is toxic.
Oh my gosh, yes. And that's one of the things I ditched probably, like 4 years ago, was when I realized like none of this stuff is regulated. Like it's not regulated, and yet we're putting it on our skin, which is one of our primary elimination organs. And so what is it? They estimate that the average woman puts on over 300 chemicals a day just on their daily care products. So these are known hormone disrupting chemicals. They are carcinogens that are in our shampoo, our body wash. And it's one of the things that your doctor doesn't talk to you about, right? So not you, because you are a doctor and you are talking to people about it, but in general, when we go in for checkups or we go in because we're having a hormone issue or a fertility issue, they're not necessarily doing that assessment to say, let's talk about your environment. Are you using products that could be impacting your ability to ovulate or sustain, and even for your spouse, because sperm is a big part of the equation, right?
Yes.
So those same things that impact you and your ability to get and stay pregnant impact your spouse as well. So I love you touched on that. That's amazing.
Yeah.
So do you, when
is that something that you talk about, like with your, I mean, because you help women with their cycles too, and you're very successful at what you do. Is that something that like your patients are readily accepting of changing?
They are, because we work very incrementally. So the very first thing that we do when I'm working with a woman to balance their cycles, get rid of painful periods, heavy periods, migraines, what have you, is actually getting your body's detox organs working properly. So getting your body used to flushing stuff out of your liver, getting it out your bowels so that it's not coming out your skin and causing hormonal, breakouts or painful cramping. That's the first thing that we do. So usually by the time they're done with their 12-week program, they're then ready to tackle their environment. So it's kind of that slow waking up process of like, we can only do so much at one time, right? To problem.
Yeah.
Especially because the women that both you and I work with tend to, it's like there were a lot of signs leading up to the point that the person is now sitting in front of us, ready to work on something. So it's not going to be fixed overnight, but we can take those little steps, right, to make a change. So typically by the time they're done working with me, they're ready to like, okay, what else can I do to clean up my environment? Because that does, that will make or break your hormone process for sure.
Yeah, absolutely.
How about you? Do you feel like your clients are pretty ready, or do you typically work on the physiology first and then environment, or do you kind of depend on where the client's at for that?
It depends. So if she is not looking to get pregnant, then we'll delve more into that environmental stuff, for a longer period of time. But a lot of times I have women that are like, I need to get pregnant today. We just have to make some like quick adjustments in that, in the detoxification portion of it, and then move on to something else. So it really depends. Ideally, I have some women that I get a hold of like 6 months before they want to get pregnant. And those are the people I want to work with, because then we could really go deep into everything. Yeah. Exactly.
And, I feel like with hormones, but specifically when it comes to fertility or infertility, there's such an emotional process with that. Do you find that the women that you're working with, do you find that they need additional supports, or do they start feeling better and start seeing improvements quick enough that kind of solves the emotional problem? I didn't mean to say problem.
No, I would say maybe half of what I do is the emotional aspect of it. A lot of these women have had serious disappointments in the past, whether that be at miscarriage, whether that be at them being talked about negatively because of their inability to conceive. Totally. There's so much like hurt that women that I work with have. And so half of it is doing that work, doing that emotional work.
Totally.
So even dating back, I like to go back to a woman's like past, their teenage years. I find that a lot of the women that I deal with that are having fertility issues were raped. A lot of them have like a lot of psychological stress. And so I think that's what makes my practice great, is that we're able to break those barriers psychologically. Yeah. And then once we get to the diet, that's easy. I mean, changing your diet, after you've overcome that trauma, that stress, and you're yourself, you're appreciating yourself even more, you're saying daily affirmations, things like that, then of course you're going to want to feed yourself the best food. So
Right.
yeah, absolutely. That support is mostly why people come to me, really.
Exactly. And I think it's honestly, and it's the same for my practice. So I think it's the most misunderstood component of what we do is the coaching and support piece, because it's missing from women's health in general, like as a practice. It's not there, which is part of, I think, why we've created what we have, right?
Yeah.
To give people what we didn't have and giving them that support that we need. And I think, I think you're totally right in the sense that there's a lot of these, what I would call invisible factors to whether or not a woman's going to get pregnant, things that influence our ability to conceive because of emotional trauma, like rape. That is physical and emotional. It has drastically changed somebody's life, and our body, even down to a cellular level, we know this, like, changes when something like that happens. And so it's almost like we have to deal with that circumstance. Like you said, if the body is going to say, I'm ready to receive a pregnancy.
Yeah.
Would you say that's true?
Yeah, pregnancy is tough. Pregnancy is not just someone just, hey, I'm just gonna have a baby and then like baby comes out tomorrow. It's a taxing process, and it's the most beautiful process, but your entire body has to be aligned with the pregnancy. And so if there's a lot of depression, that's going to affect your chances of getting pregnant. If there isn't like a good relationship within that, you trying to get pregnant, that's going to hinder it. So I ask those questions like, okay, what's your relationship like? What's your marriage like? Before I even hop on a call with someone, and the questions that I ask if the spouse is supportive. Yeah. Because it's going to be difficult for me to work with you and you don't even have support from your significant other. So yeah, you're absolutely right. Pregnancy, it takes everything. And so if things aren't okay at work, if things aren't okay here, then you're going to have problems. It doesn't mean that you have to have the perfect job, but stress is a big part of it. And so as you know, with the menstrual cycle, and whenever you're stressed out and you have all these issues, it shows up in your cycle. Yeah. And so that has to be fixed before you want to have a baby.
Exactly. I always say that your period is your fifth vital sign. Your cycle, whether or not you ovulate, if you're tracking all of this stuff and you notice that something's off, it's a vital sign. It's like you're taking your pulse and saying, what's off? Is it my stress? Is it my diet? Is there something going on relationally or environmentally? And so really, I know a huge part of my practice is teaching women how to analyze and assess those things for themselves, so that when they're done working with me, it's not like, great, I was given a diet plan that worked, because it was there for me, but now it's, I actually know what to look at. I know how to fix this myself. And so I know that that's a huge part of what you do as well, is like, we're never going to have a perfect environment, right? Or pregnancy or periods or what have you. But if you can learn to take a step back and say, what caused a weird period this month, which then is obviously going to affect fertility, your next cycle. What can I do differently? Maybe I need to have that conversation with my spouse I've been internalizing and avoiding because it's hard, not realizing that that's going to impact, whether or not I'm going to get pregnant next month. Like those things that we just don't think about unless somebody tells us, right?
Right. Absolutely.